This program, while curated to help you improve your health, contains general advice and should not replace the individual advice of your medical practitioner.
What is the perfect poo?
The perfect poo is one where you sit down on the toilet and the poop comes out and it doesn't make a splash. If it's too splashy, that means it was too hard and you didn't have enough fiber. If it's a little too wet, not to sound too gross here, I guess, but then, something else is going on. But one that just goes out nice and seamless and doesn't make a splash. That's the perfect poo.
In life, it's normal to have ups and downs. But what do we do when we get stuck? I've always been fascinated by the health journey. Why do some people get better while others fail to make the shift? In Season 1 of The Shift, we explore the fascinating field of gut health and help you discover what is really going on with your digestion, microbiome and health.
The gut is amazing.
Changes our concept of the human body. Become useless to the healthcare system.
We're always shifting. Your genes are shifting, your microbes are shifting, everything is shifting.
I'm Katherine Maslen, and this is The Shift.
Throwing up, you can't eat,
constipation,
severe stomach pains,
mental fog,
acid reflux,
change in your bowel habits,
skin rashes, acne,
fatigue, and brain fog,
almost like a feeling of intoxication,
diarrhea, and IBS.
I would say bloating is number one.
Bloating. Number one symptom is bloating.
I think by far the symptom that bothers people the most is bloating. If I had to choose one magic pill that would completely eradicate one symptom, it would be bloating. It's amazing how much bloating can actually impact somebody. I mean, we all get bloated. I don't think it's avoidable. I mean, if you eat something that doesn't settle right with you, or you get stressed out, or anything, people get bloated.
That was integrative gastroenterologist Dr. Marvin Singh. Like Marvin, I find that bloating is a symptom that bothers my patients more than anything. And as Marvin mentioned, we can all get a bit bloated from time to time, but for some people this can become really significant and this can be really uncomfortable or sometimes even painful. This seemingly simple symptom can be one of the trickiest things to treat because of its multiple causes. It can come and go, seem to be from one food then fine the next time you eat it, and can take quite a while to correct if the cause is more systemic, like in the case of SIBO. So what is the process that causes bloating? Dr. Marvin has the facts.
Really, bloating there is excessive gas production or fermentation going on in your bowels, in your gut, and that can create a distension of the tubular GI tract, which can cause abdominal discomfort. Also, people may get bloated if the GI tract doesn't move along as well. That's when we use the word motility. So if the motility or the movement of the GI tract is not, reasonably well, then the colon can get distended and you may feel bloated as a result of that. It's just kind of like if you had a balloon and you blew the balloon with a little bit of air or a lot of air. I mean, you're going to feel that differently depending on how much air is in there.
Now, I'd love to introduce you to Lucy. Lucy is a 34-year-old woman from Brisbane in Australia. Lucy had multi-system health complaints and had been working with us at Shift for quite some time.
The symptoms that bothered me the most were the bloating was huge, and the bloating was making me feel feelings of like I really didn't like myself. I didn't like me in clothes. I hated myself, basically. When I was bloated, these emotions would come up where I really didn't like myself. And then when the bloating went away, I would feel fine. So that was making me think too, like, what's going on? Like, what's the connection here? I didn't feel comfortable wearing certain clothes, so I started wearing different kinds of clothes. Didn't feel comfortable in the things I used to wear. Didn't want to be in my bikinis in front of certain people. I felt so awful a lot of the time eating a lot of foods that I felt like I couldn't attend certain social events. Didn't want to have to keep explaining myself to all my separate friends because I didn't want to talk about it because it was like a negative. So it really impacted my life a lot.
This is a story that I've heard time and time again over the years. I think it's because the feeling of bloating is so visceral. It can be right there. Every time we eat, we have this worry that we're going to get bloated, and it can really play on our minds. can also be really confusing to try and figure out because it might not happen every time you eat a certain food, and it can be hard to figure out the cause if you don't know where to look. My experience has been that as people work through their healing journey, bloating can often be one of the first symptoms to go once they remove problem foods and start to heal their gut. But for some people, bloating can be very tricky to resolve. I wanted to ask Dr. Vincent Pedre what he thought.
Well, bloating will come and go. So bloating is not constant. A lot of times, bloating will be least in the morning after you haven't eaten for the night. So you've rested the stomach, and that reduces the endotoxemia that follows eating. So when you give the gut a rest, like during an overnight fast, endotoxemia reduces, inflammation reduces. So a lot of these people wake up and they say, well, my tummy is the flattest, or I feel the thinnest in the morning. And as I start eating, as the day goes on, I get more and more bloated. And by the evening, I feel like I'm 3 months pregnant. So that's a very common complaint.
Dr. Vincent mentioned that some people will have a flat stomach when they wake up in the morning and then bloating progresses through the day. This is a really clear indication that it's food that is the problem, but how do we know where to look? Figuring out where bloating comes from can be tricky, and it's worth checking in with someone who can help you to identify where the problem is. Ultimately, most bloating is caused by food. There are 3 ways which this can happen. Firstly, you may have an intolerance to a certain food. The 2 most common foods here are wheat and dairy, but sometimes it can be from a food which is harder to pinpoint. Secondly, you may not have a reaction to the food per se, but your microbiome may be imbalanced, which can lead to an undesirable fermentation of the food. This then leads to fermentation, gas production, and ultimately bloating. Foods that can commonly cause this issue are things like onion and garlic because they contain fructooligosaccharides, and legumes because of the fibrous oligosaccharides that they contain. This doesn't mean these foods are bad for you, simply that your digestive system isn't in a state that it can digest them effectively. Last of all, the food might not be problematic, but it enters the intestine only partially digested because of a lack of stomach acid, enzymes, or bile. This maldigested food can then cause irritation or ferment, leading to excessive gas and bloating. While we're on the topic, let's talk about wind, gas, flatulence, or dare I say, farting. While this topic might seem embarrassing, it's a normal and healthy process. We all pass wind every day, but most of it goes unnoticed, with the average amount being 15 times per day. So if passing wind is natural, how do we know when it's become problematic? Now, while it's normal to pass wind several times a day, it isn't normal for that wind to be really smelly. So if you're clearing a room when you pass wind, it's likely that there's a bit of putrefaction going on there. If you feel that you're becoming more and more windy, or that wind is becoming trapped, causing you any pain or discomfort, then it is worth getting investigated. Another symptom that bothers people a lot is reflux or heartburn. This is described as a burning sensation or pain in the chest or throat area, and it usually happens after eating. Integrative gastroenterologist Dr. Marvin Singh said that reflux was also one of the main issues that people presented with in his office. We had a discussion about how this actually presents and what some of the research is showing.
So reflux is a big topic of discussion, especially patients come see me in the office because we're also used to taking these antacids, at the drop of a hat. They're over the counter here. And so as a result, we all know that these medicines reduce the acidity in the stomach. And we weren't born to not have any acid in the stomach. That's how our bodies were made, to have acid, because we need that acid to help us digest the food. And so if you have less acid, you're not able to process the food that you're eating as well. And as a result, you may have more reflux, actually, because the food is just undigested. The funny thing that I also wanted to mention is that acid reflux, there was a paper, I remember a year or so ago, that was published talking about acid reflux really not being related to acid itself refluxing into the esophagus. But acid reflux is just, you could consider as just being a term to describe this burning sensation under your chest. And this paper was specifically talking about particular kinds of foods that are inciting an inflammatory reaction in the esophagus, giving you that feeling. And we think that this is acid regurgitating into our esophagus, creating this burning sensation, but it's really may not be. Gluten is actually a big one that I see, that people say that they get heartburn when they eat gluten. I mean, gluten doesn't sound like an orange or a tomato or a cayenne pepper that can give you heartburn like we say these foods do. Gluten is just, it's wheat, it's bread, these are kind of bland type things. In fact, people grow up thinking that that's what you should eat when you have an upset stomach, and people are actually having dysphagia or difficulty swallowing or even heartburn symptoms from eating gluten. And that I find fascinating. And I am a bit of a believer that, certain foods can cause these feelings. And we often talk about these, big foods like coffee and chocolate and peppermint and all these things that can give you these heartburn symptoms. And yes, they have been associated with reflux, but I don't think the literature is that robust or strong to definitively say that one way or the other, even that these big foods like, citrus-based foods and tomato-based foods are actually a cause of acid reflux or heartburn. Yet somehow we accept that as commonplace.
Isn't it so common as well? And I find it's one of the easiest things to get rid of. Unless somebody has been on a proton pump inhibitor for years, then it can be more challenging.
It's more challenging, yeah.
And these things weren't meant to be used long term.
No.
But what happens is someone goes on a proton pump inhibitor, it's just added to the list of things that they're on for the rest of their life.
Yeah.
Which is really frightening. And
it actually probably impedes their health a bit in more ways than just what some of the potential side effects are, but it perhaps allows them to do things that they know they shouldn't do, like overeat or eat fast food or junk foods more because, hey, the heartburn that I used to have doesn't happen anymore when I take this medicine. So I can have 3 or 4 drinks today instead of having just 1 drink because I get heartburn after that. And so it's actually kind of an additive effect, and that's kind of the nature of health. Is you do one thing, leads you to another thing, leads you to another thing, and now all of a sudden you have a big problem and you're kind of wondering where it came from, but it's an accumulation of multiple things over time.
You might remember my rant on proton pump inhibitors from episode 3, but if you missed it, these are the drugs which work by inhibiting the natural production of stomach acid. I also want to acknowledge what Marvin says here about listening to your body. One of the rules to make a shift is to tune in and listen to your body, because signs and symptoms are your body's language telling you that something needs to change. If we take drugs, or herbs for that matter, to mask the symptoms, we aren't really getting to the root cause of the issue. Plus, we're then in a position where we have to cut off a vital bodily function, which has consequences down the line.
Stomach acid is essential for digestion, and it's just crazy what we're doing.
This is integrative gynecologist Dr. Felice Gersh.
I don't know why using a drug that when it first came out on the market, like the Prilosec, was designed for 2 weeks of use to help heal an ulcer. Which makes sense. If you actually have an ulcer, you really need to take away stomach acid just to let it heal for 2 weeks, maybe a month at the longest. Now people are on these drugs for years.
How often do you have a conversation about bowel movements? Or for that matter, how often do you observe what's happening when you go to the toilet? I talk about poo every day, so I guess it doesn't faze me anymore. But I am aware that if your average day isn't spent asking someone how often they pass a bowel movement, the topic of human excrement can be a little bit taboo. But the fact is, we all poo. You poo, I poo, we all poo. The variation comes in how often this occurs, but let's talk about what it looks like when it is healthy. A healthy human should pass 1 to 3 bowel movements every day. More than this is excessive, and anything less than daily I would class as constipation. This is an area that people can get really confused about. They might have only been passing a couple of bowel movements a week for their entire life, so they accept this as normal. But if we look at the function of the digestive system and what it needs to do, there is actually a healthy normal for people, and it is abnormal to pass any less than 1 bowel movement every day. So how should they look? Now, this is an audio documentary, so I can't show you what I'm talking about here, but your bowel movements should be formed like a log. If they're small and pellety, they're too hard, and if they're sticky and mushy, then they're actually too soft. And as Goldilocks in The 3 Bears said, you want them to be just right. Now, if you do want a visual here, I want you to pop Bristol stool chart into your search engine. It's going to bring up a poo chart. If you're number 3 or 4 on the Bristol stool chart, congratulations, you have won the poo lottery. Lastly, on the poo front, you should feel empty or a sense of completion after you pass a bowel movement. One of the things I say to my patients is it should feel like you've had a good poo. Now, I know that a lot of you that are listening will be thinking, that isn't me. I don't fall into those normal categories. And it's not really surprising. The reason we've made an entire docuseries on gut health is because it's the number one issue that people experience. And the easiest way to assess your digestive health is to actually check out your bowel movements every day and see that they're continuing to be normal. Now, there are dozens of reasons why you can fall outside of normal. Let's first look at constipation though, and why passing bowel movements less frequently can cause issues with your health. Often people think of constipation as an inconvenience or perhaps a discomfort, but what they don't realise is that there are other implications down the line. Let's take a look at what gastroenterologist Dr. Marvin Singh says about constipation and its impact on detoxification and other body functions.
There are three main ways the body detoxifies itself. In simple terms, you pee, you poop, and you sweat. So if you're not pooping, then your body is not getting rid of the waste as it should be. It makes sense, right? Sweat, pee, and feces are all considered waste products of the human body. And so, if you are not getting rid of that waste on a regular basis, not only do you feel bad because you may get abdominal pain, you get bloated, you get nauseous because everything else upstream wants to keep moving, but it can't move because you got a hard stop near the end or in the middle, and then everything backs up. It's just kind of like you're plumbing in your house. It's just plumbing inside your body. And that actually, can contribute to, alterations in your mood and your hunger and even cravings and a variety of different things. And that just kind of feeds this vicious feedback loop. But also, your body's not getting rid of some of the bad things in your body that it's processed and wants to get rid of. And as a result, you may have reabsorption of some of these toxic products, and it doesn't really help your overall detoxification process well. So that's why you'll notice when people talk about detoxifying or getting rid of toxins in your body, one of the very first things that you have to do before you even worry about any sort of detoxification process is what is going on in the gut and how your bowel movements are. Are you having enough fiber in your diet? Do you need to take fiber? Are you drinking enough water? Because if you don't address the gut health, then it doesn't matter what heavy metal you're trying to detoxify or what you're trying to detoxify, you're not going to have as good of an effect, and you could actually probably get sicker.
The other thing I wanted to talk about was people who take laxatives long term. So they have constipation, they take laxatives, and that's sort of the only way that they can pass a bowel movement. What do you say to that?
Well, the first thing I talk to them about is what's going on in their life and what their diet's like. I can't tell you how many times just a simple educational conversation about fiber and where you can find fiber in the diet makes such a meaningful change in somebody. I think of one guy right off the top of my head who would have a bowel movement once a week and was really uncomfortable. And, I gave him this whole discussion on nutrition and fiber, and of all the things I talked about, he only did one thing, and that was just including steel-cut oatmeal for breakfast in the morning. Just that one thing actually made him have a bowel movement every other day instead of once a week, and he was the happiest guy on the planet. So, really, the diet does play a large role, in how things move. The other thing that really plays a large role is stress management, because, when you're in a state of fight or flight, you're always anxious or depressed, and your mind is preoccupied and you're not relaxing, exercising, meditating, taking time to yourself, sleeping. All that stuff adds up as well, and the brain talks to the gut, and the gut talks to the brain, and the digestive tract slows down. Because if you think of it, if you're in the middle of an emergency and somebody points a gun at your head at the ATM machine and says, "Give me all your money," the first thing you're not thinking about is, "Oh, hold on, I got to go to the bathroom. I'll give you the money in a second." Everything stops, right? It's that chronic low-grade level of stress that's even worse. You may not even be consciously thinking about it every day, every minute, every second, but it's there and it's running in the background. And if that's not effectively addressed, that's a contributing factor to constipation.
It's crazy how something as simple as having fiber and drinking water can change somebody's life.
Right.
And I think a lot of people underestimate the value of having a good poo every day.
Yeah.
So if somebody has chronic diarrhea or chronically loose stools, what is the consequence of that?
So I tell people, the GI tract is the tattletale for the body. Whenever you have a symptom, whether it's diarrhea or constipation or whatever it may be, you should kind of think about why is the body doing that. Chronic diarrhea can lead to electrolyte imbalances and dehydration and things like that. It's definitely not something fun to experience on a regular basis, and you may have an autoimmune issue. You may be taking medication that's causing it. You may have SIBO, so you may have excessive stress, and that could be causing irritable bowel and bowel spasm, more frequent stools, a wide variety of things. And so I guess the implications of having chronic diarrhea may really relate to the implications of the process or problem that's causing the chronic diarrhea in the first place.
Season 2 of The Shift is currently in production and it is going to be huge. In Season 2, we turn our attention to moods and emotions. Mental health issues are massive and there is going to be so much that we cover. Be sure to subscribe so that you don't miss out.
The Shift!
So let's recap here. Normally, constipation is caused by diet, largely a lack of fibre, a lack of water, or food intolerances. Diarrhea can also be caused by these things, but if it is chronic or severe in nature, it does need to be investigated, so please go and see a gastroenterologist or doctor to rule out anything sinister. Now, sometimes when there are loose stools, constipation, or both, you might end up with a diagnosis of irritable bowel syndrome or IBS. Since I began practicing about 12 years ago, I've always referred to IBS as a diagnostic dumping ground. This is because so many patients seek answers from doctors, they can't find a reason for their bloating or irregular bowel movements, and they end up giving them the non-specific diagnosis of IBS. While sometimes this can make patients feel a little bit better that they have a label for their condition, it often doesn't really mean anything. I asked Dr. Tom O'Brien what IBS actually means.
The most common condition that gets diagnosed is called IBS, irritable bowel syndrome. So a patient comes in and they say, Doc, I've been diagnosed with IBS. And they're very serious about it because they're suffering. And I say, well, you know what that means, don't you? It means your bowels are irritated. And they look at me and say, your bowels are irritated. Isn't that what's happening? They say, yeah. Well, that's a brilliant diagnosis. After all the tests and thousands of dollars, well, you have bowels that are irritated. Well, okay. Why are they irritated, right? Where's it coming from? And here's an example. They published this study a couple of years ago. It was a multidisciplinary team from Harvard and Stanford and these top gastroenterologists. They took 39 patients that were failures to every treatment for irritable bowel syndrome for at least a year. And they said, maybe food has something to do with this. I wonder. So they did something called confocal endomicroscopy, really fancy term. They put a camera down into the small intestine and they watched the cells of the small intestine when they put food down there. And what happened to the cells? And they found for 28, I think it was, of these people, within 5 minutes of being exposed to wheat, soy, dairy, or yeast. And some were responsive to all of them, some were responsive to one or two, but within 5 minutes, 28 of these people had leaky gut, intestinal permeability. In the study they published, they said something to the effect of, the changes were evident to everyone in attendance. And they recommended these people avoid those foods, and every single one of them got dramatic improvement. Some of them complete improvement, some of them 70%, some of them 50% improvement within a couple of months.
The way that IBS is defined by symptoms is confusing because it's really not getting to the root cause.
This is Dr. Vincent Pedre.
There's all types of criteria like how often do you have to go to the bathroom? Do you have diarrhea? Do you have constipation? They used to say, well, IBS, if you have IBS, you get abdominal pain that gets better with bowel movements, but then they found that it doesn't have to be that way. You might have abdominal pain after bowel movements. I think they're looking at it the wrong way. They're trying to define a condition by the symptoms rather than the underlying pathology. So for me, IBS, the question is there a food issue? Is there lactose intolerance? Is there fructose intolerance? Is there a dysbiosis, an imbalance between good and bad bugs in the gut? Is there an overgrowth of bad bacteria? Is there small intestinal bacterial overgrowth? Is there yeast overgrowth? Are there parasites that have kind of taken over the terrain? So the gut is like this delicate ecosystem. It's actually probably the most complex ecosystem on the planet because of the interaction between the hundreds of different bacterial strains feeding each other, eating the foods we eat, but also producing metabolic byproducts that feed other bacteria. So it's almost like there's symbiosis within the symbiosis. It's really the way that you look at it. So I think if you look at something as irritable bowel syndrome, then you're looking for how do you fix it? If you realize that 3 patients presenting with irritable bowel syndrome might have 3 different ways that they have arrived at the same symptoms, then that really opens the door to being able to make a difference for people. I mean, that's true personalized medicine.
I absolutely love what Dr. Vincent Pedre said here. We need to look at personalised medicine based on the root cause, and simply diagnosing someone with IBS really doesn't cut it. Dr. Marvin Singh had some further insight to add on IBS as well.
It's funny because I think IBS is almost, now I start telling people in the last few months that it's almost like a philosophical diagnosis. Sometimes people get the diagnosis of IBS before they've even had any diagnostic tests done. Generally, you always have to be careful before being too presumptuous that there's not actually something physically, organically going on. Somebody may have a variety of symptoms, abdominal pain, bloating, or change in bowel habits, and you may call it IBS, but you want to make sure they don't have colon cancer or Crohn's disease as well. So you have to do your due diligence as a physician to make sure that that's not going on. A lot of people, that's the case, and that is not going on. And IBS, to me, a good example is post-infectious IBS. So somebody gets an infection, you're traveling around, you get a little diarrheal illness, you have some of these symptoms, the symptoms get better, but then they just kind of linger for a while. They don't go away. It's kind of like the same kind of situation. So what's actually happening there, my belief, is that the microbiome has become imbalanced. You had a bad guy come in, shake some things up, things got out of balance, and the ecosystem is trying to find its way back to where it was, and there may be a bit of an imbalance there. And that's perhaps the reason why in some cases, we recommend taking probiotics when you have an acute illness or diarrheal illness, or even taking antibiotics, which kind of do the same kind of concept, because it helps bring some of that balance back. So IBS could really just be a manifestation of dysbiosis or an imbalance of the gut microbiome.
To summarise what we've just heard, IBS means that your bowels are irritated. The question is, why are they irritated? Is it a food? Is it a stress that's shutting down your gastrointestinal system? Is it a medication or something else? A diagnosis of IBS is essentially meaningless if you can't actually do anything about it. So far, we have talked about bloating, wind, and irregular bowel movements. All of these can cause pain and discomfort if they get bad enough. And for a lot of our listeners, you'll already be connecting the dots on your own gut symptoms. But what happened to Lucy?
I had a few instances where I actually went to the hospital because I had such bad gut pain, and that was through my early 20s. I didn't do anything about it. When I actually did start doing something about it was about 5 years ago. So the age of 28, I started looking for answers because I was just getting such painful bloating and inability to lose any weight, even though I'd switched over to a much healthier lifestyle. I'd always been open to complementary and alternative medicine since I was young. When I really started looking outside of that was probably about 5 years ago, to really start working on it, on my gut especially. And that's when I started seeing some change, some shifting.
Lucy's story isn't uncommon. Most people will wait years before they do anything about gut symptoms. Often minor gut imbalances can turn into multiple issues over time and make it much more challenging to identify what is happening and treat the issue. One of the reasons for this is, in addition to what we've discussed so far, your microbiome has a huge role to play in gut health and ultimately these symptoms. What can start out as a mild imbalance can end up causing severe dysbiosis if left for too long. Dysbiosis is a term to describe an imbalance in the diversity or numbers of your gut microbiome. This can show up as populations of certain bacteria and yeasts being higher or lower than they're supposed to be. Dysbiosis is a term that I learnt while I was studying naturopathic medicine some 15 years ago, but it's only just beginning to be used in the conventional medical world. Nutritionist Angela Pfeiffer is a specialist in SIBO, or small intestinal bacterial overgrowth, which is a more complex and severe form of dysbiosis that we'll talk about later in the series. She describes dysbiosis as
dysbiosis is imbalance in yeast or bacteria, microbes, could even be parasitic in nature. I mean, dysbiosis is just imbalance. And so is there an imbalance going on in the intestinal tract?
Can you think of somebody whose life could change by listening to The Shift? Why not send this to them right now? Together, we can help to make a shift. The Shift! This is integrative rheumatologist Ailey Cohen. You'll hear from Ailey later in the series when we talk about the gut and its links to the immune system and environment. But what she says about dysbiosis here is really interesting.
Whether it's chronic diabetes, whether it's autoimmune diabetes, depression, any of the arthritis, any of the neurocognitive disorders such as Parkinson's, Alzheimer's, there's a gut relationship and in many ways can be traced back to the dysbiosis.
A common dysbiosis presentation is what we refer to as Candida overgrowth. Advances in research have, however, shown us that it isn't just Candida that can be overgrown, but other fungal species as well. This form of dysbiosis is very common with antibiotic use and the overconsumption of sugar and refined carbohydrates, just like that of the modern diet. Dr. Vincent Pedre describes yeast-dominant dysbiosis really well.
I think that everyone talks about Candida, and that's kind of like the popular term. The Candida albicans is one of possible yeasts that could be in the gut. There's Rhodotorula, there is Geotrichum. It doesn't all have to be Candida. And in my opinion, they can all be problematic for people because they can all cause gas, bloating, abdominal pain. But yeast in particular, because of the toxins that it produces, can also cause a lot of extra or outside of the gut symptoms. So mental fog, headaches, sleepiness after meals, almost like a feeling of intoxication, rashes, skin rashes, acne. I've seen all of these things related to yeast overgrowth in the gut. Having abnormal sugar cravings, someone who maybe sometimes adds sweets here and there, but something changed. Maybe they had a round of antibiotics and then suddenly after the antibiotics, they just can't get enough sugar. For a woman, it could be easy. They might find that they get a yeast infection and then they're having recurrent vaginal yeast infections. If you have a vaginal yeast infection, you have a reservoir of yeast in your gut. There's no question about it. So that's why they tend to recur. They're very sensitive when they go on an antibiotic. They get a yeast infection. So those are some of the signs. Other things that can show up with yeast are anal itching, for example. So that could be a sign of a parasite, but that can also be a sign of yeast overgrowth. Having toenail fungus as well. So it's kind of a hint that there's excess yeast in the system. And you can do certain tests for yeast, but there's no perfect test. There's something called the organic acids test, which can look for sugars in the urine that are not produced by our own cells, but are produced by yeast cells like arabinose. And there's a bunch of other ones that can be tested. We're still kind of like evolving in those areas. And there are tests that can show up yeast. A lot of times I'm using multiple tests to put together a puzzle and put that in the context, always in the context of the story that the patient tells you and their symptoms.
Dr. Vincent mentioned some testing here. Now, what I've observed is that patients really want to understand what's going on for them, and testing can be a way for them to explore that. But what's important to mention is that these types of tests are normally ordered by a functional medical doctor or a naturopath that understand you and understand the way that the tests work. They can be quite pricey, and you really need to know what you're looking for. One of the common ways that we assess dysbiosis is by looking at different stool testing. But again, you're best to work with someone who knows what they're doing and can interpret those results so they can then put you on a plan to correct that dysbiosis and restore the microbiome health. Dr. Vincent touched on the fact that women can sometimes get vaginal thrush as a sign of fungal overgrowth. Although this needs to be tested by a doctor because you can have bacterial overgrowth or imbalance in the vagina that leads to similar symptoms. Either way, this is called vaginal dysbiosis, and it's talked about far less than the gut conversation. I asked integrative gynecologist Dr. Felice Gersh what she thought.
Yes, it's very, very prevalent, and so many women are suffering, and they go in, like I mentioned, they just keep getting the same drugs over and over. Now we know that drugs like diflucan have tremendous resistance. A lot of the different forms of yeast have now become resistant to all the traditional therapies. This is what happens, of course. Just like with antibiotics, you have so much antibiotic resistance for different types of bacteria. The same thing has happened with the fungus. So more and more, nothing's working. And if you don't get down to basics, like why is this happening? Like very often they'll be using chemicals in the vagina, the glyphosate tampons. They'll be using all these other products. They'll be on birth control pills, or they have some sort of IUD. We have to recognize that these devices and pills and IUDs are harming the vaginal microbiome.
Now, although the conversation above mostly applies to women, if you're a guy listening and I've lost you, I do have a point here. The point that I'm trying to make is that your microbes are not separate of one another. Rather, when you have dysbiosis of the gut, you likely have dysbiosis of your other microbial communities. For example, the genitals in the case of vaginal thrush, or the skin in cases of things like tinea. In this episode, we discuss the issues we're aware of, the ones that we can feel and relate directly to gut health. We spoke a lot about food intolerances, and I'm sure you want to know more on this, so I'm going to expand on it as we move through the series. In the next episode of The Shift, we talk about the issues you didn't even know were connected to your gut health, but definitely are.
Coming up on The Shift.
The correct actual medical term is ovarian castration.
That even our gut bacteria have circadian rhythmicity.
But I don't know that too many women in this day and age would settle for that.
Most people with allergies have multiple allergens.
And I kind of freaked out. I was like, oh my gosh, I can't do this again.
They get into the bloodstream, and your immune system says, whoa, what's this?
We have to step back for just a second and say that SIBO is a secondary condition. It's not a primary condition.
I hope you're loving the information in The Shift as much as I do. But maybe you're thinking, what do I need to do for me? Take our online assessment to discover what your gut is up to. Go to theshiftclinic.com/quiz.
The Shift!
This series is produced by Must Amplify. Hosted by Katherine Maslen. Executive producer Ronsley Vaz. Music and sound design by Shade Furlong. Thank you to all of our experts. For more details on them, go to theshiftclinic.com/gut.
Still listening? Reviews help us know that we're hitting the mark with what you need and help us to shape future seasons. I'd really appreciate it if you could take a few moments to leave us a review. I would love to know what you think.
The Shift!
Thank you for listening.
Every listen or download of this show
and hence this voice
directly funds the ending of sex
and human trafficking.
A voice for a voice.
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 Find out more at
Amplify.
Amplify.
Impacts.
Impact.
.com.
.com.